So there's two types of inflammation. There's chronic inflammation and acute inflammation. Chronic inflammation is more in the setting of, say, like rheumatoid arthritis. Acute inflammation is, someone just overdid it or they did something that caused a tweak to the knee. This usually occurs by turning it in some way or loading it in a way that would cause that joint to be inflamed. Typically, the inflammation won't be just pain. You'll also have some swelling that's associated with that. Perhaps you might have a joint that's warm as well. The first thing you want to do is something called RICE. So that's rest, ice, compression, and elevation. Other things that you can do is you can try taking some anti-inflammatories like Aleve or Advil and trying to avoid the activities that may have caused the acute flare-up.